वड़कम वेलकम आदाब सत श्री अकाल नमस्कार सुनचंती ओडिसा निजो नंबर 1 एफएम स्टेशन रेडियो चॉकलेट 104 एफएम तो मिठा मु आर चैनल आपन संगे तोडिया पय रेडी शुआर मु जेची धा धपड़ अवश्य आया परे मु जहा कहबी सब इंग्लिश रे कहबी कारण आज मो संगे एमती जने हस्ती अछंती जे आछंती डायरेक्ट विशाखापट्टनम एंड से आछंती महात्मा गांधी कैंसर हॉस्पिटल एंड रिसर्च इंस्टीट्यूट रु से होचंती सेटिकार एमडी से आउ केही नोंती से होचंती डॉक्टर मुरली कृष्णा जे होचंती निजे जने सर्जिकल ऑन्कोलॉजिस्ट चलो तंको वेलकम करबा शो को सो वेलकम टू रेडियो चॉकलेट
Thank you so much.
How are you, sir?
Very, very well.
How is Odisha, sir?
Fantastic.
So, Mahatma Gandhi Cancer Hospital and Research Institute. Tell me something about this.
Yeah, it's a largest cancer hospital in the state of Andhra Pradesh and adjacent states also like Chhattisgarh, Odisha and Andamans. And it's a comprehensive cancer hospital with more than 40 oncologists with all the departments for cancer treatment. From the rural outreach programs like early detection, prevention and the treatment, advanced diagnostics and the treatment as per the international guidelines and pain, palliative care, terminal care, etc. and including research programs. We are NABH accredited hospital and we serve the patients of Andhra Pradesh, Chhattisgarh, Andamans, Odisha, West Bengal and some foreign patients also.
So, you are visiting Odisha. So, any special intentions, sir?
We have been treating many Odisha patients in so many years.
Okay.
Because many patients come to us because there are adjacent districts of Odisha because Vizag is near. At the same time, we have a very large hospital with all the facilities and we have a robotic surgery for advanced cancer surgery and bone marrow transplant facility which is not there in this region for blood cancers and lymphomas and a separate pediatric oncology unit for treating cancers of the children and very advanced radiotherapy technologies like stereotactic radiotherapy, radiosurgery, etc. where we can treat even few millimeters of the tumor without having any side effects like brain tumor, etc. Because of these advanced treatment facilities, including nuclear medicine facilities, very advanced PET CT scan, nuclear therapy, because these are all the things required for cancer patients for a holistic treatment. And because we have treated more than 150,000 patients till now, so many patients, survivors, they tell about us mouth to mouth advertisement. So they come to us. And in the process, many people started coming from Odisha also. So in the process, when the government of Odisha started their focus on healthcare to get the best of the best treatment for their people in the tertiary cancer treatment facility. So naturally, they have empaneled our hospital also during the OSTF scheme, that Odisha State Treatment Fund. Later, they have extended their program to BSKY scheme, Biju Swasthya Kalyan Yojana. So, we have been treating so many patients of Odisha in our hospital as per the laws and rules and memorandum of understanding between the Odisha government and our hospital. So, we provide not only the treatment, we provide lot of counseling services. Lot of employees from Odisha were taken to take care of these Oriya patients, to take care of their language, food facilities, other services, stay, free accommodation, free stay, free food. All these things we provide so that the cancer treatment, which is very, very longer time, it may take longer time, lot of troubles to the patient. We'll try to solve all the problems so that their entire stay during the treatment is comfortable, so that they don't need to look for any other solution, because the hospital itself will provide lot of solutions. In the process, because we have treated so many cancer patients, the government of Odisha, in their motto of encouraging quality services, they have taken feedback from a lot of patients and identified and awarded the Mahatma Gandhi Cancer Hospital and Research Institute Visakhapatnam as the for the Chief Minister Excellence in Healthcare Award. We have been awarded that award for our excellent services for the Oriya patients. So to receive this award, we have come to Bhubaneswar and visited Bhubaneswar today.
The hospital is in our neighboring state and they are treating our patients like anything, and the award they have received from the Odisha government thanks to BSKY Yojana, as says. Any plans of Mahatma Gandhi Cancer Hospital and Research Institute opening in Odisha?
Yeah, we have been allotted a land in Berhampur for starting a cancer hospital in Berhampur. At the same time, recently you must have heard that the government of Odisha is starting an 120 bedded cancer hospital at Jharsuguda with an expenditure of 170 crores. However, they have done that a lot of auditing and bidding and all. Then we have been selected as the company hospital to run the hospital that is being planned at Jharsuguda. So we have already started participating in the designing of the hospital and all, but that hospital is going to come in 2 years. So we'll be entering Jarsuguda first to treat that particular
Region.
patients from that particular region.
So, sir, what do you feel? Odisha has done some advancement in cancer treatment, but still there is some more requirement. And as you said, the facilities that are available in Mahatma Gandhi Cancer Hospital and Research Institute, they're very helpful to the Odia patients.
Yes.
So, when Mahatma Gandhi Cancer Hospital and Research Institute comes to Odisha, so how it will be helpful in bringing that new technology and helping these patients, those who are deprived of that technology, sir?
Definitely it will be helpful, because cancer treatment is not one day treatment, you come and go, because the treatment may require surgery, radiation and chemotherapy. Sometimes the treatment goes for 1 or 2 years also. They have to make so many visits to the hospital and go back. Then if the breadwinner is affected or the family of a breadwinner is affected, there will be a lot of stress on the family because of the travel and logistics. At the same time, if that is at the doorstep, the hospital is the doorstep, technology is the doorstep, definitely it will be useful to the patients. Doctors also, in our hospital we have 30% of the doctors are Odia doctors, but if we are in Odisha, maybe 80% of the doctors from Odisha, then there will be a lot of comfort to the patients also in communicating and explaining to their problems, etc.
When we say Dr. Murli, you remind of something Munna Bhai MBBS, Sanjay Dutt. So he's like Sanju Baba there, the senior most surgical oncologist. So Dr. Murli, I just wanted to know, BSKY, some schemes are there, ESI schemes are there, but still some patients are there, those who are affected with cancer, and they don't have that facilities to enter a cancer hospital. And you say, as you say, the treatment is very long, it is very hectic. So how do they get this good treatment?
There are so many schemes which cater to all the strata of patients, like BSKY patients, and there are groups of ESI patients. Then there is an Ayushman Bharat scheme.
Okay.
So, and over and above, there are certain group of patients we have identified who are poor, but they're not eligible for BSKY
Right.
treatment. Then in those cases, there are two ways we help the patients. Like, we talk to the government authorities and send them a letter of recommendation that his patient is poor, and they can provide financial assistance through a credit letter. The second option is, we do have so many NGOs associated with us, like they provide financial help to those poor patients who are not covered under BSKY. And also we do crowdfunding through internet and various channels, particularly for children who are affected with blood cancers, leukemia, thalassemia, sickle cell anemia, which costs more. Sometimes government cannot afford to fund all those treatments to the fullest extent. In those patients, we get crowdfunding and help of some CSR funds of various industries and our own cancer foundation, that is called Shreya Cancer Foundation.
Very much thank you, sir, about this information. I hope those who have listened to sir, they may apply for these opportunities like Ayushman Bharat, BSKY, ESI, or else approach the hospital itself. So, being a senior most surgical oncologist in this field, not only this southeast region, but also in India, what do you think, what is the state of cancer in India now, like other countries? How well are we tackling with this disease?
Because of the huge population and various lifestyle issues, the number of cancers increasing in India, and because of the better awareness and better availability of the early detection methods in various government sectors, etc., the number of cases in the early stages also they're increasing in India. But at the same time, because of the aging population, illiteracy and lack of financial facility to go for the test, we are seeing a lot of advanced cases also in the hospitals. So definitely the numbers are increasing, and there is a lot of less reporting also. Many cases are not getting reported in the registry, so that we don't know the exact numbers. But definitely there is a change in the number of cases. The change in the number of cases, like earlier, cervical cancer is more common in women, but now breast cancer is more common. Particularly when we come to the Orissa region, because of the oral tobacco chewing, because gutka, khaini, jarda, pan masala, etc., we see a lot of oral cancer patients from Odisha state in our hospital. We operate and we treat so many patients, but the problem is many people, they come in a very poor oral hygiene, and sometimes they can't even open the mouth. So such bad situations also people are coming. I think we have to raise awareness and we have to completely fight against the tobacco utilization, maybe many industries they don't like it, but 40% of the cancers can be preventable. So completely we can avoid 40% of the cancers if we stay away from tobacco, alcohol, and get some vaccination for liver cancer and cervical cancer, and maintain good body weight and do a regular exercise, so that we can avoid 40% of the cancers. But as a whole, the numbers are increasing, and we have to work more towards the prevention, at the same time early detection, than giving the financial support to the patients who are getting treated at an advanced stages.
Thank you very much, sir. So, as says, prevention is better than cure. But if it happens, then early detection is very important for the treatment of a disease like cancer. Thank you very much, sir. You came and explained about Mahatma Gandhi Cancer Hospital and Research Institute and how it helps patients so accurately. Thank you very much, sir.
Thank you very much, listeners. Radio Chocolate.
सुनदान रेडियो चॉकलेट फील को था तो धूम मीठा.